Thank you all. We're going to go ahead and get this kid. Good morning. I almost said good afternoon. I'm looking outside. It still feels like it's, I don't know, afternoon, morning, but good day. For those of you that don't know me, my name is Dr. Gilbert. I'm the president of the Dignity Health Medical Group, and I'll be one of the co-hosts here. We're all going to attach me here. I want to thank you all for joining us today for this ribbon cutting ceremony for our brand new family medicine residency clinic here in Gilbert. It's really exciting. I'm honored. Just when I look around, it's just amazing to see so many folks from different roles here. We have community members here. We have leadership here. We have Dignity Health leadership all across the board, staff, team, construction, IT. I mean, it's just amazing. So I just want to say thank you all for joining us on this amazing historic afternoon. So we're celebrating, right? What are we celebrating? We're celebrating a clinic, but it's more than that. We're celebrating a milestone where you have Dignity Health Medical Group partnering with our Dignity Health East Valley Graduate Medical Education Program. That's a lot to say right there. Coming together, creating a clinic, but not just a clinic for training our future leaders in family medicine. That's what's really exciting about this. In other words, this clinic will serve as the hub for training our future primary care leaders. And that's important because in this day and age, we all know that there's a shortage. And what's amazing about this, and y'all will see when we go through the tour. And by the way, when I was walking around earlier today, I was joking around with everyone, but I'm ready to bring up my stethoscope. I guess that old saying is, they always do things better after you leave. I wish I had that special. And when you see the state of the art, it's just amazing what it has to offer. That environment is conducive for training our family medicine residents to let them really grow, nurture, thrive in this particular environment, which then gives back to the community, giving that best top-notch care. Equally as important, I think I mentioned, this will also serve as our, really bringing back that top talent into our system. So as we train them, we recruit them. That's the goal. As we embark in this new journey, though, I do need to acknowledge now, there's a long list of folks that I can acknowledge, and I apologize, I will not be able to call everyone's names out. But there are some individuals, some of the co-hosts that are going to be talking today, that I think it's important to acknowledge them, otherwise we wouldn't be here without their help. And it's all from the Dignity Health team. I want to acknowledge Dr. Roger Bees, who will talk soon. He had this vision. He's our lead for our Graduate East Valley Medical Education Program, which I'll let him speak to. Dr. Creechy, our Residency Program Director, we would not be here without really getting this work, because we are starting this from the ground. We're running, we're moving forward. A lot of work to be done behind the scenes. And of course, bringing this together, the glue is really our hospital partners. So our president, Mark Slider from the hospital side, and of course, all the staff, all the team. Thank you all so much for really coming together to make this happen. The opening of this family medicine residency clinic signifies our pursuit of excellence in healthcare in the communities we serve, and that's here. I'm so proud of what this team has accomplished, and I'm excited what is ahead. Thank you all for being part of this really amazing, momentous occasion. Now, in keeping with our culture, we'll be starting this special event with the reflection, so I will invite, please welcome Chaplain Thomas Harbaugh. Thank you. Thank you.
If you're like me, you may have grown up thinking of doctors as almost superhuman. As a child, I just assumed that all doctors knew everything and could fix anything. They were the smartest, kindest, and most skilled adults that I could think of. I was simply in awe. Admittedly, this picture was somewhat skewed in my teen years by the depiction of physicians on television, who are often arrogant, pushy, and in it for the financial gain or the adrenaline rush. Now that I've had the opportunity to serve in healthcare for a few years and see behind the proverbial curtain, it's clear to me that neither picture is fully accurate. Doctors are just people who experience stress, who can get it wrong, and who work in an ever-increasingly complicated environment. They are pulled in many directions by a wide array of stakeholders including insurance companies, policymakers, regulators, administrators, the community at large, and somewhere in there, patients. This system grows more complex every day, and it requires state-of-the-art technology, innovation, and a collaborative army prepared to rise up for the community and public health. This army will be made up of people, not superhuman people, regular people, who just want to make things better. In a way, this is even more spectacular than superhumans who were born gifted and already have all the answers. Because this means that they didn't just stumble into this thing. They have chosen it. They have accepted a prompting to do hard things. This reminds me of the great stories from our ancient texts, how God calls on regular people to do extraordinary things. The stuttering Moses, who is to become a great speaker and lead the captive people to freedom. The orphaned Esther, who became queen and delivered them once again. And the young, unassuming Joseph, who went from slavery to be the right-hand man of the Pharaoh of Egypt. Like these ones, medical providers have a specific calling on their lives. Just as the prophet Isaiah heard from heaven, "Whom shall I send, and who will go for us?" They have replied, "Here I am, send me." They have been set apart as helpers and healers who now seek to be equipped. The Dignity Health Medical Group Family Medicine Clinic is just where that will happen. They will be steeped in a culture of human kindness, trained in compassionate care, and taught to integrate their skills with their hearts. They will practice inclusion and justice as they live on mission with excellence and integrity. So today we do celebrate the future impact of medical professionals that will be making in this community through this clinic. We recognize that regular people will be doing extraordinary things because they will be equipped to answer their calling. Today we dedicate this building that it might be a crucible, shaping our community's future healthcare leaders to overcome the challenges of tomorrow as they love and serve our community. So I ask that you would join me in prayer to that end, that this vision would be realized. God of all, we give you thanks. Give you thanks for the ones who will answer the calling to come and fill this building, who will love and serve this community, who will be the keepers. God, I pray that as we dedicate this building, that we will remember where we come from and where we are going in the future, that we'll keep our eyes set upon you, and we just give you thanks, and we celebrate today. Amen.
Amen. Thank you, Chaplain Thomas. That was beautiful. Really brings back to why we're here. We are called to serve. And so I'd like to introduce our next hosting with this conversation is a committed leader with our Dignity Health East Valley. As I mentioned earlier, a great partner, supporter of the medical group, and really just, again, we wouldn't be out here without his support and help. And that's our CEO, Mark Slater.
As usual, they give me a bulleted list of things to talk about, and I probably will use it a little bit. Because I really just want to speak from the heart. First, I want to thank all of our special guests here. This community is a collaborative group of leaders just relentlessly trying to make this a better place to live, work, and raise a family. And we are just the healthcare component of that. But I will tell you, we really rely a lot on the leaders here in this community. We've got Kathy, who is with us today, who's on the council. She's been on our board, our hospital board. She was on our development committee that helped drive. She was in some of the initial conversations about 6 years ago when we were just exploring what we would do with graduate medical education. And other council members, Scott Anderson's here. Bobby Buckner. Joe's here. Joe Ferguson.
Yeah.
Jim. Sorry, Jim. He's new. All right. or new to me. Is Patrick here? I don't see Patrick. Oh, he's in the back there. Okay, Patrick. Thank you for that Lindsay interchange, and we really appreciate it. So, I'm not sure if the others are here. Let's see. Chamber, is Sarah here? Oh, yeah, there she is. Carrie's here too. Carrie's a Chandler chamber, but she comes over here. Thank you, Terry, for being here. Did I miss anyone? Julie? She always comes. Okay, we're good. Hey, listen, this was something, just think about this place. You know, about 10 years ago, not too much more than 10 years ago, plus there's just a pasture. And then all of a sudden we have a hospital on it. And then now we're talking about very advanced children's care, women's care, and holy cow, we're talking about graduate medical education, an academic medical center right here in the town of Gilbert. This is just a tremendous growth, and quite frankly, bringing these services right here in our community so that we won't have to travel outside this community to get the care. One of the biggest challenges, and quite frankly, this wasn't on our radar screen 6 years ago. And Roger's going to talk to you about some of the vision. It really wasn't on our radar screen about doing graduate medical education. We were just trying to keep up with the basic demands of the community. And we had multiple conversations with the medical staff. And there was an overwhelming support of our medical staff leaders to move in this direction. So we started to explore it with the board and having those discussions and medical staff, and really took it down that path. And you're right, Dr. Bees, he'll tell you, it was really a vision and something he and others really championed along the way to get us to this point. But I just want to put this into perspective. I mean, there's a huge need for primary care. There's a huge need for, Arizona has a gap in physician need in almost all the different specialties, but particularly in primary care and family medicine. And so that's what one of our emphasis was when we went down this path, was to add to the family medicine complement in this area and internal medicine complement in this area. Today we're celebrating the family medicine and the opening of their clinic, but we've got an internal medicine program that also is starting, and it's home base, and its location will be at Chandler. We have general surgery, we've got emergency medicine, OB around the corner, so we're going to have, what, 100, 150 or so residents that are going to be going through our programs here, being trained in our community, making a huge economic, hey, did you hear that, Patrick? A huge economic impact to the community. All right. As well as a huge clinical impact and an improvement to the access of care in this community. So we're just, listen, we're thrilled. We're thrilled about what this milestone will mean to this community. We'll look back this in years to come and say, wow, what an important component that was to delivering the very best care close to home in our town of Gilbert. So we really appreciate that. And really, I'm going to turn this over to one of the visionaries, one of the lead visionaries of graduate medical education. And quite frankly, this wasn't his first visionary rodeo. He's the one that started cath labs and cardiology in this area, was in that, and then we stole him away into administration, and he led this, and then we added this graduate medical education to his plate, and he's just taken all of this and just led with just a real vision and a real dedication to make it the very best, and pick the best leaders as well. So I'm going to turn it over to Dr. Roger Bees and let him make a few comments. So Roger?
Thanks, Bob. Give me way too much credit. You know, I was coming up the elevator with Dr. Yagnesh Patel, who's our Vice President of Medical Affairs, and just thinking back, when I came here 25 years ago from an academic appointment in Colorado as a professor there at the university, and Mercy wasn't here, Chandler was a little 138-bed community hospital, and if you had asked me back then if I ever imagined myself in this position of opening graduate medical education and being the DIO for ACGME, I never would have believed it. In fact, I probably would have ran in the other direction. Knew we were going to be doing this. So that was 25 years ago. And, you know, fast forward, you know, what a blessing this is going to be for our community, for our hospitals, for our families, for our children, for our grandchildren, to have graduate medical education, which has been proven to elevate the quality of care that's provided in every facility that these get put into. So even though we're already top performers in what we do here for medical therapy, both Chandler and Mercy Gilbert, this is going to take us up to another level. So it's been a journey, and you know, Mark gives me credit for it, but really when he came here as the CEO, he was part of, because he had done this at other institutions, part of exploring the conversation, and the feedback, like he said, that we got from our medical staff was very positive, and we were surprised, because I was talking earlier that previously, maybe 20 years ago or 15 years ago, there wasn't that much interest in graduate medical education. So things have changed, but a lot of our physicians have been trained at the best university institutions around the country and come in here, and we still have a pretty large private practice group, but this footprint of the Dignity Health Medical Group now in the East Valley is becoming a very important partnership and growth strategy for us. And so finally we're going to have that connectivity with family medicine on this campus, internal medicine on the Chandler campus, so that our patients have a place to go if they don't have established physicians, and our community has a clinic that's going to be providing excellent health care, and they'll have that reputation, so they will be the provider of choice for anybody who wants to get medical care here in Gilbert or in the Chandler facility. It was a challenge to get this thing started, for sure, especially from scratch, because many of us have not run graduate medical education programs in the past, including me, even though I came from an academic program that was already set up. So I was just kind of plugged into everything that they were doing. So this has been a steep learning curve for all of us who've been doing it, and it's just been so impressive that each program that we've applied for, we've gotten accreditation. So ACGME has been very impressed with what we put together, the quality of the administrative backup and the quality of the physicians that we've engaged to do that. And with that, I want to really give kudos to Dr. Krejci, because first of all, we were extremely lucky to get him in the first place. And it was actually Keith Ray, who was our chief medical officer for the Arizona division, who was at the same church, I believe, was the connection there. So they, and Rick and him met at church. They were both family medicine colleagues. Dr. Frey used to run the program over at the Mayo Clinic. And then when we started interviewing for the FM position, I think he got him in a headlock and apply for the job. So, but how lucky were we to get him? And he and his team, Marlene, who works with him, has just done an incredible job putting that program application in, getting us accredited, bringing on outstanding faculty, and doing something that probably no one really gets to do, especially if you're plugging into an existing program, designing the space that you're going to see today and how it's going to help the whole strategy of how it's laid out enhance the education of the residents coming through our program. So congratulations, and very impressive. Thank you very much for everything you've done. We are just a couple weeks away now from having our inaugural class of residents. June 19th is our first day of onboarding. We'll have 28 residents in family medicine, general surgery, and internal medicine attending that day, and we have a 2-week period where they have to learn Cerner and get their ACLS and do all their dignity modules online. You know how fun those are, but we'll get them through all that stuff, and then that first week in July, they're going to be here. They're going to be working in the clinic, they're going to be working at the hospital, and it's going to be the beginning of something amazing that this community is going to live with going forward, you know, for years and years, decades to come. So we're really looking forward to getting this started. What a privilege it is to be here, to be part of this, and for all of you to be here too to help join us get this thing kick-started. So thank you all for your time today, and again, congratulations, Rick. Good job.
Thank you, Dr. Bees. It's great to see how that vision has now come to reality. Here we are. So next, I'd like to invite our Vice Mayor Kathy here to give some words. And again, really having the community stand behind us with this is amazing. Here we are. So I'll let you have some words here.
Thank you so much. I have a little speech, but I think Mark was looking over my shoulder and took all of my key words out of my speech. So first, I just want to say what an honor it is to be here. I served for 25 years as the CEO of the Gilbert Chamber, and during that time, I served for 10 years on the Dignity Board. And it was such an honor to do so. And one of the key components of serving on a community board is to not only monitor the excellence of services that we provide, but also to look at what gaps are in the community and how we can fill those gaps. I think Mark has been trained very well that Gilbert has a high expectation of Dignity to be an economic driver within our community, which is, I think, why you said that to Patrick in the back, and I appreciated it. But over the years, as Mark mentioned, we identified different services that could be provided in our community, and without the leadership within Dignity all the way to the top, we wouldn't be where we are today. And I want to thank all those who served on the board with me. We were never quiet or shy about sharing our opinions, and the fact that you had the team around you to make it come to fruition is just amazing. Higher education within our community is another priority of ours, and thank you so much for agreeing to be here with us in Gilbert. And with that, I just wanted to say that on behalf of the town of Gilbert, we're so proud to be a partner with you. I won't go on and on. I'll just say thank you, and looking forward to the ribbon cutting and the tour. And most importantly, when the students are here and we start the services. So congratulations. Thank you.
Thank you, Vice Mayor Kathy. Really appreciate that. It's all about collaboration. Here we are. So with that, I think it's an opportune time for Dr. Creechy to come up here and have him have the opportunity to talk about this program, and it's all yours.
Thank you, sir. Well, good morning. It's great to see you all here today. Thank you so much for joining us. It's amazing. It was just over a year ago, April 20th. I just looked at the photo. A year ago was our groundbreaking ceremony here on this property, and it was just dirt. And so what a difference a year makes. I just want to add my thanks to each of you for taking time out of your busy schedules to celebrate with us this morning. It is truly an honor for me to stand before you as we open up this beautiful family medicine clinic together. Today marks the beginning and ending of many things. It's the conclusion of all the planning and hard work that went into this building, and it's the start of providing care for the good people of Gilbert and our surrounding communities in this wonderful new space. It represents the end of preparations for our new state-of-the-art family medicine residency program, and in 2.5 weeks, the beginning of training of the next generation of family docs right here in Gilbert, Arizona. It also serves as one of my career high points, and also as a truly humbling moment to reflect on the responsibilities that we have to the medical providers of tomorrow, as well as to our community. Dr. Bees mentioned care of the future, and I just want to expand on that for a moment. This clinic was designed to incorporate technology in the service of our patients and learners. Part of our mission statement says that we will leverage team and technology so that our graduates might thrive in their chosen careers. And in this space, as you get the tour in just a little bit, you'll notice in the exam rooms there's wall-mounted computer monitors in each exam room. And that's there so that we can actually check in our laptop to the monitors and invite our patients into their medical record and share data with them real time. In addition, thanks to generous donors and the hard work of our Dignity Health East Valley Foundation, we have secured a handheld portable ultrasound machine for every resident who comes through our doors. And this thing is an ultrasound machine. It's amazing. Point of care ultrasound is the first major innovation in the clinical exam since the invention of the stethoscope. And we look forward to training our residents in how to use these things well. I'm very proud of the core faculty that we've been able to pull together for this residency program. We've really been blessed with an extremely talented and passionate team of physician educators who are truly dedicated to both patient care and teaching. It's my honor to introduce them to you now, and you're going to want to pay attention to this because this is where you'll learn who your tour guide will be. So as soon as I'm done speaking, we're going to cut a ribbon, and then we'll all go in. So the color on the border of your name tag indicates the color of your tour group. You don't have to move around now, but after we cut the ribbon, you'll want to find your color-coordinated tour guide. So to start off, Dr. Kylie Preen, who is blue. So remember that, all of you with blue name tags. She's a Chicago native who did her undergrad here at ASU, did her med school at Midwestern in Downers Grove, Illinois, and her family medicine residency at Advocate Lutheran General Hospital in Park Ridge, Illinois. She's thrilled to be back here in the Valley, and so are we. Dr. Preen is a doctor of osteopathic medicine and incorporates musculoskeletal techniques in the practice of family medicine, and will also be heading up the training of our osteopathic residents in that technique. Dr. Andrew Wong, there he is. He is green, so for everybody with a green name tag. Dr. Wong grew up here in Phoenix, did his undergrad and medical school at U of A, and did his residency training at the University of Kansas's Via Christi program in Wichita, Kansas. He's committed to full spectrum family medicine, including OB, offering prenatal care and deliveries for our pregnant patients. He's also a point of care ultrasound instructor. Dr. Violet Sulamonova, she's hiding over here. She's yellow. And she is a California native who did her undergrad at San Diego State University, her med school at Ross University, and her residency at UCSF Fresno. She's worked as a hospitalist and brings her love for inpatient medicine to our family med program. And Dr. Jacqueline Nguyen, there we go. Dr. Nguyen is red. She grew up right here in the East Valley. She did her undergrad at ASU and her med school at U of A, where she stayed on for her residency training. She too is dedicated to full spectrum family medicine, including women's health, and she serves as our associate program director. So we're really thrilled to have her. For those of you who have a name tag that has no border on it, the white group, I'll be your tour guide for the rest of the day. Or maybe just the rest of the morning since I have clinic this afternoon. As important as our faculty are, we don't do this work alone. It takes a team, and I want to introduce the rest of the team to you. So we'll go quickly, but I'll ask you folks to wave as I introduce you. Our excellent medical assistants are Lori Durbin and Esmeralda Cardenas. The ever-capable Michelle Springer handles all of our front desk responsibility. You guys are so shy. Nicole Weber is our practice manager. Ann Hutterly is our clinic supervisor. Not shy. And Anna Woodruff is our clinic coordinator. She gets shoved out into public. All right. Medicine is well known for having its own language and for its acronyms. So I'll now ask all of our PWGSs, otherwise known as people with giant scissors, to please join me over by the door for the ribbon cutting.
My elected officials, please join us.
There's not enough scissors there.
Well, you can stand there. We'll stand. Yes.
We're going to stand, Scott.
We're going to stand, yeah.
We're going to stand. I'm just going to squeeze over there.
I'll be fine. I'll text you next time and say, don't do it, don't get job. There you go. And then I only have 5 minutes. I got this. I kind of nothing in front, nothing in the other,
You gotta get up front. We're gonna pretend, I'm sure. Behind me, we're gonna go. Are we all gonna kind of say? Just get ready to
sorry.
Oh, nice.
Big smiles. 1, 2, 3. Hold that. Keep that going. Make sure you get all the paparazzi here. Get a picture. All right, good. Everyone got a shot. Are we really cutting this?
I reckon.
You reckon? You reckon? Okay.
Yes. Yeah.
You reckon this. Okay, hold that. All right.
Everybody gets a cut.
All right.
We'll take it, okay.
On the count of 3, you can just cut it to shreds. Ready? 1, 2, 3.